Hello and thank you for joining me. My name is Dr. Lynn Gerner. I've been a chiropractor and a cranial therapist for over 15 years with a specialty in pregnancy, birth, and lactation. My subject today is the infant cranial anatomy and how it relates to breastfeeding. Successful breastfeeding isn't always easy. In fact, I say that more often than not, it's actually really hard in the beginning. I've talked with countless new moms who were exhausted and desperate for help. Getting the help of a lactation consultant either in the hospital or privately is very helpful. That person can help with techniques such as different ways of holding your baby while nursing and making sure that your nipple is placed deeply within her mouth for a proper latch. Sometimes though, mom's technique alone just isn't enough and we need to look closer at the baby. Are there physical barriers preventing your baby from opening her mouth fully and having a normal latch and suck? One such barrier might be a lip or tongue tie, preventing the tongue from reaching the roof of the mouth. Sometimes though, another barrier is the actual alignment of the baby's skull, including the jaw and the upper neck. I've been approached by many lactation consultants and birth professionals in the past looking for answers to what they thought they were seeing, but they just didn't have all the information to identify it. Let me show you. For the sake of keeping this brief, we're going to look at just a few main areas that, when imbalanced, often get in the way of normal breastfeeding. The first main point is the upper neck. Does your baby struggle to nurse on one side more than the other side? This is usually because the first neck vertebra, which we call the atlas, is rotated or twisted to one side, making it difficult or uncomfortable for him to fully turn his head. An interesting side note about the atlas, there's a hole between the atlas and the bottom of the skull where the 12th cranial nerve, which is called the hypoglossal nerve, exits from the brainstem. Now, what does that nerve do? It controls the tongue. So excess pressure due to a misalignment in that area can literally make the tongue weaker. So let's see how this actually works. As a way of a disclaimer, this is an adult-sized skull. A newborn skull actually looks more like this. However, I like to use the large skull because it's a great learning tool because it's conveniently color-coded. So, the atlas that we were talking about is right there. It sits right underneath the base of the skull. The other area we're going to look at right now is this orange bone, which is called the temporal bone. Do you see how it sits very, very closely between that atlas and the temporal bone? There's soft tissue that connect the two. When one moves, it takes the other one with it. So what tends to happen is something like this. The atlas will rotate from one side or the other, and what it does is it takes this temporal bone with it, and it in essence works like this. It causes a twisting of those temporal bones. Now that temporal bone is half of what we call the TMJ or the jaw. So when it becomes imbalanced or shifted like this, it causes the jaw to be out of balance and it makes it hard to impossible for your baby to open his mouth normally. Now, I like to say in my world, everything is connected. So if we follow this orange temporal bone, it leads us directly to this yellow bone, which is called the maxilla. And directly underneath the maxilla, if you can see or imagine, is this bone here called the palatine bone. And you may have guessed it, it forms the soft palate or the roof of the mouth. Have you ever been told that your baby has a high or uneven palate? A high palate makes it hard for your baby's tongue to reach all the way up to the roof of the mouth in order to have a normal suction and to stimulate that nursing reflex. The part that seems to get the most attention by therapists are the muscles. Remember that all of the muscles of the tongue and jaw are attached at various points on the skull and neck. When these bony attachment sites are out of place, the muscles are pulled or tethered. Again, the tongue, jaw, and neck cannot move normally until these structures are balanced. These are just the basics. The entire skull is like a three-dimensional puzzle, each piece having its perfect place. If we try to put a piece in the wrong place, it causes the disruption of the whole rest of the puzzle. In reality, the proper balance and motion of the skull affects so much more than just breastfeeding, including the normal flow of fluid in the spinal canal and your child's neurological development. But that's a whole nother lecture. So how does this misalignment happen? Well, in many ways. The baby's skull and spine at birth are mostly cartilage and are very pliable. The bones of the skull are meant to overlap each other during the birth for an easier fit through the birth canal. But often they just don't come back together normally. Imagine the strain to the skull in the case of a long extended labor or a vacuum extraction. An obvious example of this is what we commonly call a cone head. Imbalances to the baby's head and spine can also occur in utero if the baby is in a compromised position for a long period of time. I imagine every single woman watching this who has ever been pregnant can remember her baby feeling stuck in a certain area in her belly for a long period of time. So the question running through your mind is probably, how am I able to help with this? Before I describe my technique, let me address the word chiropractor, because I know that often confuses people. Chiropractors traditionally perform adjustments on adults by way of a thrust that causes a popping noise. This is not the technique used for an infant. As I said before, the spine and skull of an infant is mostly cartilage and is extremely pliable. Cranial work and spinal adjustments for an infant are made up of non-force, very gentle acupressure and massage type contacts. I have extensive training in the specialty of infant body work. This technique is very different from usual. Studies show that if breastfeeding is painful or difficult for more than 2 weeks after birth, a large majority of mothers give up. If you're watching this video, then you know the long-term physical and emotional benefits to nursing. It is my hope and passion that mothers and infants receive the needed care to allow successful breastfeeding. Again, I'm Dr. Lynn Gerner. Thank you for joining me.